So Dr. Butler, the floor is yours.
Thank you. Those of you who were here last week, I think it's 2 weeks ago now. Is that right? 2 weeks ago? Mm-hmm. Just check. We talked about the staging of Alzheimer's disease and related dementias. We talked about mild, moderate, severe. And the behavioral changes that you see with dementia come on when the person has communication difficulties. So they're starting to get their language involved. They're starting to break down communication. Their memory is greatly affected. Their short-term memory is having major holes in it. They're forgetting names. They get lost. And they're getting into a situation where they're having problems dressing, picking appropriate clothing. Now they're starting to get into communication issues. And when you get into communication issues, if you're trying to communicate with somebody and you can't get through to them, what happens to you? You get frustrated and upset, don't you? If I were to go and do that to him, I'm not telling him that I'm doing that to him, and keep doing that to him, eventually I'm going to get a response back that's not very good. Right? So if you miscommunicate, and you're miscommunicating, and the way you're miscommunicating suggests by your body language that you're upset, or you're stern, or you're angry, guess what's going to happen? You're going to get a stern and angry response back. So as caregivers, we have to learn to play the poker game. We have to put our poker face on. When I say put our poker face on, I talked last week about people with dementia can't change how they react to us, usually. But we can change how we react to them. So we don't, even though we mightn't understand what they're doing, we're going to play neutral. We're going to play calm. We're going to play warm. And if the person likes touch, use touch. If the person doesn't like you touch, don't use touch. Because that will incite an aggressive response. Okay?
Dr. Butler, could you just take one step back for the video? Thank you so much.
So what we will do today is I'm going to walk you through some of the things we think about in terms of the approach to behavior with people with dementias. Okay? So we talk about challenging behaviors, and the behaviors that challenge us are either verbal or physical, and the aggressive ones are the bad ones. Sometimes the non-aggressive ones can be bad. So if you get somebody who's pacing around and following you around all day and all night, you can't get to sleep. That could be a challenging behavior. If you get somebody who's doing this. We had a fellow one time, he went around, and on the rails he'd be knock, 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 knock. And guess what his job was? He was a boiler man. And in the boiler man, they go around and tap the pipes. And they're looking for airlocks in the pipes for fear they might explode. See? So when he went into the nursing home, he would tap on all the rails. So what we had to do is we had to put cloth around the rails. Once we put cloth, we could dampen the noise down, and then he was okay. He could still go around all day and do his tapping. But we couldn't stop that behavior. That was procedural memory that he had burned into his brain from 30 or 40 years working as a boilermaker. We're not going to erase those circuits. Those circuits are in there pretty well permanently. Okay? Causes of responsive behavior, we'll get into that because sometimes there's something going on in the person that causes them to make a certain behavior. So if they got a urinary tract infection and they're burning in their bladder, probably going to be upset. Right? So maybe you're trying to tell us something, we're misreading. Creating a safe and comfortable environment. That's important, isn't it? Because if you got somebody who doesn't know how to lock the doors, who's going around and turning the burners on, how are we going to make that environment safe so that person can exist and not be a danger to themselves or somebody else? A problem-solving model we'll talk about in terms of what's our approach when we got a problem, and how are we going to sort it out, and how can we do a better job at trying to meet our loved ones' needs, and approaches to care. So we'll talk about those things today. Okay. The Alzheimer's Journey on the Road. This video discusses what to expect in the middle stage of Alzheimer's disease and related dementias and provides information on day-to-day issues and resources. And Liz, we have that here, right?
Yes, we do.
Yes, here? Good. And you can access that from the Alzheimer's Society locally. Behaviors that may challenge us, physical and emotional. Resisting. So you want to, I did a house call yesterday, I won't say where, it was in St. John's. So that narrows it down to 100,000. I can't get any more specific. This person had severe pain, and the caregiver couldn't get him to his bedroom. So I'm in there on a house call. What are we going to do? He's resisting. And now he does respond to mail, so he couldn't respond. So I knew, before I left that house, we had to get him in his bed. Because if not, that poor caregiver was going to be up the whole night downstairs with him. So we did a couple of things, and we got him to his bed. But one of the things, he was resisting. And you'd ask him to walk, but he never had enough cognitive ability to know which leg to move. So I'd take him off balance on one side, and he'd bring his leg, take him off balance on the other side, and he'd bring his leg forward. So by doing that, knowing how to do that, we got him upstairs. And then I called her, just before I came in here today, I gave her a call, and she says how thankful she was because the medication we were using for his pain had settled down, and she could get him out to the bathroom easy today, and it wasn't too bad. And she was so... Now, that intervention, just a little tiny bit, what did that do for the caregiver? Fantastic. Yesterday, she was telling me, I'm going to have to put him in an institution. I got no choice. And today, she's saying to me, I can see the light now. I can see light again. I think I'm going to be okay for a while. Just little bits, little tidbits like that. And that's why I think this First Link program is so important. If we can give caregivers little bits of information, little tricks how to do it, we can make your life a whole lot more, lot more efficient, a lot calmer, non-violent, loving, nurturing, and that's where we want to be. We want to be in that nice, calm zone as much as we can. Right? Restlessness, wandering, repeated actions and questions, and aggression. So the person is asking the same question over and over again, 100 times a day. How can you deal with that? Aggression, one of the big parts. Suspiciousness or paranoia. Interesting, suspiciousness or paranoia comes in the early middle stages of dementia, and they have 3 or 4 delusional systems. One is you're stealing my money. Another one is you're having sex with another man or another woman, and you're really trying to do something nasty to me, aren't you? Trying to kill me. Those are 3, and they're fairly consistent actually. The sexual expression gets distorted because, and especially in the late stages of dementia, you lose your natural inhibitions. And then that raises a whole lot of issues in terms of, especially institutionalization, where the husband may be misprinting with another woman, and he thinks she's his wife and she's not. The family are dealing with that. How do we deal with that? It's a really hard one, right? And then if you lose your filter, then you can go out and take your clothes off or be masturbating in the public place in a nursing home, and then all the ramifications that has on the family. So these are things that we need to talk to people about so they can understand that this is the illness, not their loved one, and this is the way we'll deal with this when we get to it. So this is so just to anticipate, so you know what the behaviors to anticipate are. Anxiety or fear, and that's a big one, and anger is a big one. And when you're fearful as a caregiver, the person knows it, and they will feed off your fear. So you've got to handle that one with a good poker face, right? So emotional and physical, very tough.